Hello, ladies and gentlemen. Divine here, the pharmacist with a difference. So today, I'm here as a hospital pharmacist. So I'm just want to talk about the factors that determine the selection of antimicrobial agent. Factors determining the selection of antimicrobial agent. So that's what we're looking at today. Okay. So factors that of course determine selection of antimicrobial agent. Okay. Now, what you need to understand that there are 6 important factors that of course determine the selection of the most appropriate antimicrobial agent for a particular patient. These are factors that must be followed importantly, and they help, of course, clinicians and prescribers to make decisions, okay, regarding selection of the most appropriate antimicrobial agent. So number one, first thing is what we call organism identity. Organism identity. I'm going to explain them. First, let me list them. Identity. Number two is what we call its susceptibility. Number three is what we call site of the infection. So site of the infection. Number four is what we call site of an infection. Host factors. Okay, so host factors. Number five is what we call safety of the of course of an agent. Okay, safety of an agent. And of course number six is what we call cost of the agent. So these are important factors that of course determine the selection of the most appropriate antimicrobial agent. Now the first one of course is what we call organism identity. You need to know what organism is causing this patient's infection. So these are of course is infectious diseases. I'm talking about infectious diseases. Okay, first thing of course, to address the problem, to treat the patient successfully, they need to know the organism itself that is causing that patient's problem. That's the first point. Number two, of course, what we call its of course stability pattern, meaning that for this point here we're talking about to which drug is this organism susceptible to. What drug can eradicate this organism after knowing the organism itself? So this is about what we call the drugs that can clear out this organism. The third point, of course, site of infection. You need to understand the site of an infection. Where the infection is very important. Why? Because there are different drugs that can reach different site of infection. So that depends, of course, what the nature of the drug itself. For example, when the disease is in the brain, for example, let's say the organism that we found is in the brain, we need to choose the drugs that have got excellent tissue penetration, the drugs that can go, of course, and cross the blood-brain barrier with higher concentration. So for that purpose, you have to know what is the site of an infection. Okay, so sites, and for example, it's in the kidneys. Some drugs have got just simply a large more plasma concentration, but when it comes to tissue, site concentration is very low. For example, if it's a pneumonia, you have to pick for an agent that has got excellent lung penetration. So you're picking on drugs with a good lung penetration that can reach the site of action, site of an infection, and eradicate those organisms effectively. So that is very important to know the drug side of an infection. If it's the blood, it's the sepsis, is it the lung tissue confined infections? Is it of course the prostate, for example, prostatitis, that of course prostate infections. You need to go for drugs that have got excellent penetration, like for example fluoroquinolones. They're good for that type of infections. All right. So host factors, so factors of a person you are treating also are very important. This is why we say host factors. So what are we looking at with regard to host factors? Number one, here we're looking at basically the presence of other comorbidities. For example, does the patient that we're treating, do they have a liver dysfunction, or are the kidneys okay, or do they have other parameters that of course can interfere with our drug selection? because some drugs, of course, that require to be metabolized by the liver, and if somebody has the liver which is not working properly, that of course can interfere with our drug selection. So we take into account the state of the organs that are major metabolizers or organs of drug elimination when choosing the drug. For example, if somebody has got maybe pneumonia, that is quite severe pneumonia, of course, or so sepsis, secondary to pneumonia, with a complication, of course, of kidney dysfunction. You want to choose between ceftriaxone and cefotaxime. Of course, you're gonna go for what? For ceftriaxone, because ceftriaxone is more of renal friendly, of course, but of course, even that drug as well, in cases of severe renal dysfunction, you need also to adjust the dose of ceftriaxone, because it's up to 63% renal excreted. But in that context, is more safer in that patient who has renal dysfunction compared to cefotaxime and other, of course, cephalosporins. So that's very important to understand, of course, the host factors. In the case of where someone who has what we call liver dysfunction, okay, for example, liver is not okay, some drugs, of course, let's say those that we use treatment of tuberculosis, some drugs like pyrazinamide, all right, rifampicin and isoniazid, those drugs, of course, can cause hepatotoxicity. So for such purposes, you have to adjust the drugs or use other drugs because of the patient. The patient has what we call an organ dysfunction. So that is another way. So all this is important to understand the host factors when you are choosing the right, of course, agent for the patient. The other part, of course, the safety of an agent. That same safety is important to establish the safety of that drug that you are picking for the patient. How safe is this drug in this patient? So you have to look at the safety profile of the drug itself. Can this drug, of course, cause more harm to this patient than the disease itself? For example, in the case of amphotericin B, you are weighing, of course, the risk of the drug itself with the disease patient factor. So you look at weighing the benefit outweighing the risk. So you have to consider the safety profile of the agent before you pick it out. So it's very important that as when you have drugs in the pharmacy, you need to know which drug is going to be better for this patient or not. So you have to establish, of course, knowing drugs individually, and from there selecting which one is going to be more safer than the other. So for you to choose for the patient. Of course, the last point is what we call the cost of agent. So we don't just guess drugs, say, hey, bring this drug there. No. We look at, of course, the cost. That's why pharmacies are very important. We're looking at the cost itself of the treatment itself. Just look at one drug. Look at the cost of the drug for the patient. You've got other options, for example. Let's say you've got other drug. Let's say you've got a patient who's been found with Pseudomonas, which is susceptible or sensitive to number one, peptides, simple, easy, piperacin plus tazobactam, and also meropenem. So these two drugs, of course, has shown that both drugs are able to clear out this Pseudomonas in the lungs. And then you want to choose between the two. All right. So look at the cost as well. First, after you've done all these factors that are validated there, you look at also the cost. So which one, of course, is cheaper? Which one can the patient manage? So you look at also the cost of the therapy. So if you find that peptides is quite cheaper compared to meropenem, then you pick that drug. You go for that drug, and then that's how you go. But so all these factors are very important in determining the selection of the most appropriate antimicrobial agent. Now, this is the very important thing to understand. Now, let me summarize and say this. So there's some infections where you don't have to follow this order. For example, you won't just some patient that may come with severe disease, okay, where quite, of course, toxic patient will come with severe, you aren't gonna do culture first to identify the organism first. You aren't gonna do that. Patient will die if you delay that. So such patients are started on the treatment empirically, as you're waiting, of course, for these results to know what organism is causing the patient problem. This is the ideal way, but for patients with severe infections, you first start the patient empirically. Then you draw, of course, before you start the patient on antibiotics, you get that, of course, doctor has to get the blood samples from the patient, and then start the patient on the antibiotics, because you can't start drug first and then draw the sample for testing. You might get false negative results. So for some severe infection like meningitis or sepsis, any kind of form, based on the patient status, you won't just rush starting them on antibiotics. You won't wait to get the organism identity. You start the patient, of course, empirically, where you, of course, have to simply examine the patient to establish the source of the infection. Is it if it's sepsis, you look at, of course, the possible sources. Is it primary sepsis? Is it secondary to what? Is it, of course, the lung? Or is it the soft tissue infection? All those things, of course, are taken into consideration, and then start the patient. If it's a meningitis we know, of course, the most important causative organisms across the populations. If it's the neonate, you know that of course you worry with Listeria, as well as of course group B, Streptococcus. If it's of course adults, pneumococcus comes first, of course meningococcus as well, and other of course population, other organisms like Klebsiella, what you call this, H. influenza, those are also other Pseudomonas. Those comes at least if it's an elderly, you worry about also pneumococcus number 1, number 2, of course, Listeria. So all those organisms are empirically covered. In such cases, you know what would be causing that. So this is what I had today, simply on showing you what factors or determine the selection of the most appropriate antimicrobial agent. You can follow me on also YouTube channel, what we call Farm Divine, for more videos. Thank you. See you next time.